Thank you, Rocaille, and good morning, everyone. I'm not going to make you say good morning back to me unless you want. That's up to you. As Rocaille said, my name is Bruce Wilcoxon. I'm the Director of Public Policy for ConocoPhillips, one of the large oil and gas companies here in town. But more importantly, for this morning, I've been, for the past couple of years, serving as the co-chair of the Executive Committee for HLM and also as a member of the Steering Committee. And I say it's been a pleasure these past few years to be involved in that process. So what we're going to do here with the panel discussion until about 9:40 is to delve a little bit deeper into the process that went into creating the community action plan. You know, when you look at the document, 25-page-ish document, it's easy to lose sight of all the really hard work that went into getting us to this point. So we want to take a little bit of time this morning and highlight some of that work, like Rocaille said. And we've already covered, I think, some of the introductions, but I'll just introduce, in addition to Rocaille, again, the other two folks on the panel here this morning. On the far right, we have Dr. Bakeyah Nelson with the Harris County Public Health and Environmental Services Department. It's taken me 2 years to be able to string all of those words together successfully, so thank you for that. I like the acronym HCFED. It's an awesome acronym. And Bakeyah has, like Rocaille said, Bakeyah has been leading the assessment team. That's a big part of the work that was produced over the last 2 years. And then we have Tim Schauer with, I could have practiced this one as well. Tim is with, Cornerstone, with Cornerstone Public Government Affairs. And Tim has been the HLM lead for the public policy team. And so what we're going to do is we're going to give Bakeyah and Tim a chance to give a brief overview of the work that they've been doing for the past couple of years. And then we're going to open it up to questions from you all. So while you're listening, we'll hold the questions till the end. While you're listening, please work on those difficult and challenging questions. Don't let them sit up here for 20 minutes and drink their bottled water and just relax. Be prepared to like I say, bring forward some challenging questions. So with that, I will turn it over to Bakeyah.
Hello. Good morning. I am Bakeyah Nelson, Public Health Analyst for Harris County Public Health and Environmental Services. As Rocaille mentioned, we went through a very extensive assessment process, and some of you might be wondering how we identified our priority communities for the work that we did. And we really went through a five-step process to identify the focus neighborhoods that we ended up working in very intensely. So the first step of that process was to review the existing data that was available. And so we went naturally to the Health of Houston survey. And for those of you who are unfamiliar with the Health of Houston survey, UT School of Public Health did this survey, and the survey actually breaks down the community, Harris County, into 28 different community areas. And this is our main source of information at the sub-county level as it pertains to knowing risk factors for childhood obesity and adult obesity. And so we looked at that data to try to pinpoint which communities looked like they had elevated risk for childhood obesity, adult obesity, and other risk factors as well. Once we did that, we then considered other factors, as Rocaille mentioned, such as what community assets were in these communities, what could we build upon, and what could we leverage in order to carry out this assessment work. After we compiled all of that information, we then went back to our community planning team and presented all of this information. We had a dialogue process, and then finally a voting process, and that's how we ended up in the near North Side Fifth Ward community and the Pasadena South Houston community. From there, what we had to do was then focus in on neighborhoods within those broader community areas because they were so large. And so at that point, we worked with a group of consultants, a group of engineers, as well as a food assessment consultant, to really pinpoint what the focus neighborhoods within these broader communities should be. And so we drove around, we looked at additional data, we looked at campus level data within these communities, we looked at fitnessgram data, just a whole host of data. before we were able to then identify the 3 focus neighborhoods where we did our built and food environment assessment. And as Rocaille mentioned, the built environment assessment really consisted of looking at the infrastructure surrounding the schools. And for our food assessment, we looked at what foods are available. So we went into convenience stores, grocery stores, et cetera, to try to determine what was the access to food within these communities. And that was really the process for identifying our priority communities. We also did focus groups with parents. We did surveys. So in addition to the broader community and stakeholder engagement process that Rocaille mentioned, we also did community and stakeholder engagement within the priority communities as well. In addition to the built and food environment assessment, we also heard that we wanted to learn more about early child care, the practices and policies going on in our early child care facilities, as well as our schools and our districts. And so we also did assessments of our local school districts, as well as our early child care providers. And that was really the extent of the assessment process. We were then able to, Tim and I worked collaboratively throughout this process. And when we had findings, we would discuss what they were, and that fed into the policy process and the policy scan. So I will turn it over to Tim at this point.
Thank you, Bakeyah. And before I start talking about what the policy process was, I can't take ownership of this because the policy team was so critical to make this happen. Raise your hand if you participated in at least one of the meetings with the policy team. I know some of you are here. Margaret's here. Dr. Bakeyah is not here. Oh, she is here. There you are. I didn't see you this morning. Good morning. Dr. Bakeyah should be recognized for her outstanding work as well. But we had a lot of people participate in the policy process. So what I'm going to give you as a report is not just things that I ended up kind of coordinating, but it was a lot of work, a lot of input from a lot of people. We started last summer, literally organized and said, all right, we're going to have monthly meetings for the next several months, as long as it takes to figure this thing out, right? And figuring out policy is one of the biggest challenges when you start talking about any public health program, because people immediately want to jump to a program. Operations, what is going on? Let's fix this. Let's do a health literacy campaign. That seemed to be kind of a theme right away. And I'm like, hold on a minute. That's not really a policy. That's a program. That's something that we are going to do at some point. Now, we may end up having policy down the road that focuses on individual programs, and we want to get those programs going in the right direction. But if we only work on one program, we might be missing some of the bigger factors. So we really, for the first several months, we wanted to explore this problem. What's going on? Where is it? Across, is it only certain parts of Harris County? Is it only certain zip codes? Is it only certain areas? The answer is, of course, no. It's worse in some areas than others, but it's across the county, regardless of income levels. It's just a matter of how bad in those communities and how advanced is the level of childhood obesity. And we really wanted to understand the complexity of the literature. What is the research out there that tells us, why do we have this problem? Is it age? Is it location? Is it the influences? Is it the diet? Is it access to food? Is it what's going on in our education system? Is it our families? Is it our community? What is it that causes it? And I think all of us kind of in the back of our mind, because most problems, usually once you focus and really figure out the problem, you can go, look, there's a silver bullet. Here's just the thing we need to do, or the top 3 things. If we just do these 3 things, well, raise your hand if you think that there's just 3 things we need to fix. I don't see a whole lot of hands go up. Good answer. That's exactly what the committee came to as well. Unlike most problems that I've worked with over the last 20 years of my experience in public health and healthcare, the complexity of this problem grew. It didn't simplify. We couldn't prioritize into just a couple of things. It became more and more complex the more we went. Now, the interesting thing about complexity, and if I can quote H.L. Mencken, for those of you that have never heard this quote, for every complex and difficult problem, there is a simple solution, and it's usually wrong. So we need to embrace complexity and say, okay, it's going to be a tough problem. It took us a while to get here. It's going to take us a while to get out of here, and we may have to explore some things that make people a little uncomfortable. We may have to explore some things in our modern culture and say, wait a minute, there are a whole lot of factors that came together. Well, when you start looking at complexity, you go, oh my gosh, how do you digest this thing? And so one of the first projects we did was, all right, well, let's break it apart. Let's figure out what's the best way to break it apart. We had almost an entire meeting just talking about what's the best way to group this. Is it by location? Is it by age? Is it by activity levels? Is it neighborhoods? And we ended up doing kind of a matrix approach where we looked at each age group, kind of 0 to 2, 3 to 5, 6 to 10, and 10 to 18. And then within those age groups, broke them down by what are they eating, what are their influences on food, and what are the activities. Because 5-year-olds have different challenges than junior high kids, right? Of course they do. And the strategies and the policies that govern where they are, what they eat, what they do, how much oversight they need for their activities are going to be significantly different. And we embrace that complexity. So as we went through that process, literally we reviewed, the literature review was unbelievable. The amount of work, and I wish Elise Hebb was here. She's moved on to California. She's got a great job doing some other things, but she helped us really organize and put together an annotated bibliography of the literature that was out there. Our team spent unbelievable numbers of hours reading reports. Rita was wonderful at constantly feeding the policy team additional information and reports, and these issues keep coming out. Now, one of the frustrations I will say is that not many of the other communities that have embraced this have a whole lot of research to say X works, Y doesn't. It just isn't there yet. This whole country has a problem with childhood obesity. We're right there in the forefront, but unfortunately, not a single community yet has figured out how to fix this. So we're on the forefront of trying to fix this, and part of the assessment, part of what we're doing, and part of the evaluation is measuring what we try and what we're doing, does it have the impact that we hope to have? So when we boiled it down, we came into 4 chapters, and of course policy people, you know, we could argue all day as to how you organize this, but we came into a school chapter, a child care chapter, a community chapter, and a family chapter. And we really dove into those things and wrote them up, who's for things, who's against things, what are the pros, what are the cons, how would this be implemented, and we thought we were absolutely brilliant, except for when you then take that to the community and try to explain it, by the time you're done explaining it, people are looking at you like, what? So Susan, where's Susan? Raise your hand, Susan. Outstanding input from over here. She said, why don't we just organize it simply by eat, play, and learn? And I went, wow, that's brilliant. And it worked perfectly because we reorganized some of the ideas into these 3 categories so that we could ask the community. And I trust the community. The people that are in communities often have the best insight. Why? Because they live there. They know the issues. And we said, well, these are the 3 categories. Can you help us prioritize some of these things? And so at those community forums, the policy team was very actively engaged in listening and watching and seeing what people did. And then we had a little voting activity where they gave us the prioritization. And that is where we came up with the 15 policies under Eat, Play, and Learn. It is in the back of the report, you've got a whole list of all the other, I think, 47 policies that we reviewed, and several of them are brilliant ideas, and they may at some point be things that we want to implement. But the communities that we interacted with, our Houston, Harris County region, helped us come up with some policies, not only that we studied, we looked at, we know that they have some influence, but these are the ones that collaboratively we believe will have the most impact going forward. So that's how the policy team came up with these.
Hey, Bruce.
Good. Well, thank you, Tim and Bakeyah. And, I think hopefully even this brief introduction, including Rocaille's introduction, gives you a feel for what I think is really the power of this collaborative, and that is the combination of really thorough, in-depth policy analysis with what I call the ground truth, both the assessment and the engagement process. You can do one or the other, but putting those 2 together, I think really, like I said, it's a really powerful product. And so with this, we got about 10 minutes, and I will open it up to questions from the audience, and I'm sure this is not a shy group, almost positive of that. I think we should have some microphones circulating, so this one here. This one will be the microphone that's circulating. So if you have a question, please raise your hand, get your hand up, and we will call on you. And if you would, if you would introduce yourself, it's always good to get a feel for who's in the room. Introduce yourself and what organization you may be representing.
I just like having the microphone.
We can cut that off at any time.
Right, thank you. Because sleep is such an important part of my day and I don't get enough sleep, and for our children, I would think sleep is a very important part of their health, yet many children don't have good beds or places to sleep. How does the plan address providing a bed for our children so they have a good night's sleep and making sure that that's a part of our, you could say housing policy, but it also is part of our health policy as well?
Thank you. Very interesting question about sleep.
I think we briefly touched on the issues of adequate sleep and kids that are staying up with screen time late into the evenings, whether it be movies or playing on their video games or playing whatever, rather than, schoolwork. If you miss sleep because of schoolwork, I can't really necessarily jump in and fix that. I think everybody would agree the academics are important, but where we talked about that was really in part of the health literacy conversations. Now, I don't think we ever talked about providing beds or even a housing policy for the overarching community. Claire, Margaret, anybody else join in? But I don't think we specifically talked about any bed provision, but we did talk about adequate sleep. And unfortunately, a lot of families, at least from the things that we've talked about, don't even understand that sleep has a huge influence on obesity. And that's part of where we talked about a health literacy campaign. If you look at our LEARN policies down here, we really talk, people don't know what's good for them, good foods. We've actually got a second generation now of parents who often grew up as a kid eating a whole lot of McDonald's and Burger King. God bless those organizations, but they're really not good for us, right? And we should know that. So health literacy includes adequate sleep, adequate activity, good foods, the right things. That's part of really what we talked about. Does that answer your question?
Thank you. What else? Other questions? We're on the right-hand side there. Oh, that's a long way to go.
I bet I can be loud enough to hear.
Okay. I can repeat the question, too.
I was just wondering what the plan is for communicating this to the masses, because all of these things are great, but if we want buy-in from our school districts, and oh, by the way, I'm Kelly Sullivan, ALEF ISD Wellness Coordinator. If we want buy-in from all of the different communities, groceries, schools, we have to have ways to get this information to the people who matter and make the decisions in those school districts.
Great question.
Yes, very good question. In fact, that's a question that's come up throughout the planning process, and we recognize that media advocacy is a very important piece to the work that we're doing. And what we anticipate in the next year is that we have to rev that up. I think throughout planning, there's a lot of benefit just through the one-on-one connections and a lot of the just relationship building. So we spent an inordinate amount of time with just establishing, firming up relationships or creating new relationships and seeing areas where there could be some potential collaboration in the area of communication and reaching out to the media once the plan is actually launched. And so I think the community at this time is probably more ready to know what our priorities are. And if there's anyone who's interested in taking on that kind of work, we would love to hear from you, because it's going to really be that's going to move this initiative to another level where it's much more visible, and will also help us prepare for some actions that actually will require some state level intervention as well. So thank you for that.
Good morning. I'm Andrea Caracostis from the Asian American Health Coalition Hope Clinic, and I do need a microphone. So I have two questions for you. One is addressing obesity from the start, which means prenatal care. We don't do enough to promote breastfeeding, and we know that breastfeeding is one of the first things that you need to avoid or prevent obesity in children. And the second thing is Houston is the most diverse city in the whole country, and we don't do enough to address the cultural aspects of obesity in our community. We see a lot of our children that come from other countries or have a multicultural family that are the ones that are at highest risk for obesity. We see at the clinic children as young as 6 months that cannot sit because they're so overweight. And because it's for the parents that come here, having availability of excess food is such an incredible news that they simply overfeed their children, but there's not enough efforts to educate them about how to feed them early on in the developmental stages.
All right, that sounds to me like we've got a volunteer for E3. And seriously, we're looking for leadership on some of these issues. And we're going to move into policy into action right after the break. But if you look at our number 3 recommendation on the back of this report that's in your folder, E3 is clearly one that she's going to prioritize. Thank you very much. We'll put you on the list. And I'm only partially joking. I'm serious. We need people to engage and own these issues and say, I care about this issue enough that I'm going to push it. But I will talk about a little bit more about that later. The second thing I want to talk about is L2, which is what she also supports, because part of a community health literacy strategy, particularly in Houston, has to look at multicultural approaches to health literacy. We know that. Anyone that lives in Houston knows that Houston is an amazingly diverse community. That's both a blessing and a curse. The blessing is we've got some amazing restaurants from all over the world. The curse is those amazing restaurants serve really good food in huge portions, right? And we may need to try to interact with them and try to talk them down in the food portions a little bit, maybe. I don't know. Is that something that we want to talk about? But the health literacy campaign, and it's come up twice now, is absolutely critical to moving forward. The lack of information, the lack of understanding, the confusing messages that people get from our current media is unbelievable. So it is something that I really appreciate the passion over there, and we're going to get her connected.
Nick, I think we have time for one more. Rick, hand up.
I can probably shout.
They're shouted out.
I'm Jessica Honley. I just moved here from Buffalo, New York. I'm a food systems planner. And I was actually curious about the complete streets policy and how that can be incorporated into private developments. So private developers are really in charge of their own private piece of property. And I'm curious how we can engage them to make those developments more walkable and pedestrian friendly.
That's a great question, and the complete streets issue, gosh, we spent so much time with that, and by the way, welcome. We're glad to have you down from Buffalo. I'm sure it's a little colder there than it is here today. And you might have a bit more snow than we do, even though, the snowpocalypse was kind of a miss. If you look at P1 and our play thing, not only does Houston have an issue with complete streets, which interestingly enough, our mayor just adopted a city complete street strategy. But we actually believe we need more than complete streets. We need what we're calling a safe neighborhoods policy. And complete streets, just having sidewalks is only one sub-bullet of that. We need to fix our streets, fix our lighting. We need to get rid of the wild dogs. The number of pit bulls that are running around. God bless dogs. I love them. I've got 2 of them myself, but they're in my backyard. Well, one's a golden retriever, so he's just a big dumb dog. But the pit bulls, and if you've ever been around parts and driven through Houston, it's a scary proposition. The people that walk, most of them walk with walking sticks, and it's not because they need to walk with the walking stick. It's because they have it to keep the dogs away from them. We've got a serious problem. And that's something that we need to address. Is that a policy program? Well, that's actually more programmatic, working with the budgets of the city to make sure animal control is properly funded, that they have the staff to get out there and move forward. But those are some really big, important issues that the Safe Neighborhood Policy is going for. Now, the other issue that you talk about in new developments, interestingly enough, out in the suburbs, most of the new developments, simply because people demand it, are pretty much complete street friendly. There's a few still left that are popping up around the Houston area that aren't complete streets, but most of them, if you look around, most of the developers we've talked to, the complete street strategy is what helps sell homes. So they're building them that way. They're putting in neighborhoods, they're making sure they have bike paths, and that's a good thing. It's our older communities, it's some of the areas within the city that we still have, the open storm sewers and no sidewalks and very dangerous areas. And those are some of the areas that we've got to figure out. How can you go in and retrofit, if you will? And when they go in and fix the storm sewers, make sure they put in some sidewalks, try to correct some of those things. But we'd love, again, your passion. You are now connected to P1. Thank you very much.
And with that, I think we'll call this session to a close. I want to thank Rocaille, Tim, and Bakeyah. Hopefully, and thank you all for the level of engagement that we're already seeing today. It's going to be really important to a successful day to have everyone engaged. Hopefully, even in this brief introduction, you get a feel for it if you don't have that feel already. Or, to me, the complexity of the issue. And you start peeling the onion, and it gets very complicated very quickly. But there is a path forward on it. And, we all know what's at stake. So with that, please join me in thanking the panel.